is my coworker, Rachel.
Hi,
Rachel. Nice to meet you. My name is Jane.
And my name is Raquel.
Oh, nice to meet you.
So the first question we have for you, Rachel, is what are some educational licensing requirements to become a case manager?
In a lot of places, you need your associate's degree. Some might require your bachelor's, your master's in social work. It's also good to have like LVN, licensing nurse. So you know what's going on with patients clinically.
What does your typical day look like being a case manager where you work at?
Busy.
Is it?
So a typical day for you, we come in, we have admissions, and I'm the admission coordinator, I do my rounds, a lot of follow-ups, a lot of documentation paperwork with health plans and making sure that they're getting, everything that they need.
West Coast Skilled Nursing Facility Case Manager Raquel, how may I help you?
Hello, this is Jane, the insurance representative from West Coast Insurance. How are you?
Hi, I'm doing well. How are you today?
I am doing well too. Thank you, Raquel. So I would like to ask about Havoc's rehab therapy progress because we're trying to determine his LCD's last cover day, and we will need to look at his reports and notes to determine that. So I just wanted to follow up with you.
Yeah, so before we decide, let me go talk to his therapist and let me grab my notes from the rehab gym.
Sure, I'll hold.
How is therapy going with Havoc?
Ready? 1, 2, 3. Other hand. Okay. Oh, his therapy is going great. We did toileting this morning, and he's upgraded to contact guard with his transfers. Oh, you want to do more? And I'd say he just needs like another week or two to work on stairs at PT because he does have stairs at home.
Okay, so you feel like he's really progressing with his therapy?
Yeah.
Awesome. And Havoc, how do you feel like you're doing? Are you ready to go home and be discharged? Right, Havoc. So I actually have your insurance on hold in the office, so I'm going to go ahead and let them know how you're doing with therapy. Hi, Jane.
Hi, Raquel. I'm still here.
Hi, awesome. So I spoke with Havoc, and I was also able to speak with his occupational therapist, and she feels that he's getting stronger and he's going to be ready for discharge within the next week.
Oh, okay, that's so great to hear. So I'll just wait for you to fax over the notes, and once we review that, I'll provide authorization for 1 more week for Havoc.
Awesome. Yes, I'll fax the notes over and we'll continue from there.
Okay, thank you, Raquel. Have a great day.
You too. Bye-bye.
Bye.
Are there other settings that case managers can work at? Yes, there. The settings. There's a wide variety. There's a medical case manager, social worker case manager. There's mental health case management. So there's different ones for different. What motivated you to become a case manager? I love to help people, so I'm more in the social work aspect of it, and I just really like when patients come in, get their rehab or whatever they need, and they can go back into the community. So that's kind of my main goal, is to be here, help either the rehab team or the clinical team, try to motivate them.
What is the biggest dilemma or hardship that you've encountered in your profession as a case manager?
Right now, it's health plans. We are experiencing a high level of HMOs, Medicare and Medi-Cal, and it's, when they get in, those health plans want the patient to get better in a couple of days, couple of weeks, and go back home. Sometimes there's scenarios where the patients have been at the hospital for quite some time, and it takes a little bit more time for the resident to get, back on their feet. And I'm always having a constant battle with other case managers to give me an extended stay.
How do you collaborate with occupational therapy?
There's a lot of times, people come in here that are physically declined. Seeing them, work with physical and occupational therapy, help them get back to their ADLs, and, like as simple as brushing their teeth, they get, to do that. Or getting up, standing up, or anything like that. Yeah, guys like that. It's alright.
Yes.
Yeah, but yeah, just seeing occupational therapy work on them with all their again ADLs and helping them get better is good.
Yeah, rewarding, right? In all your caseloads, do you usually see occupational therapy as one of the major interventions that the patients receive at the current setting that you're working at?
Yes, we see a lot of successful stories.
That's awesome.
That I've been here and working, more closely with patients and seeing how they interact with OT. We see more success.
Knock, knock. Can I come in?
Hello.
Hi, I'm Raquel. I'm your case manager, and I'm here for your interdisciplinary team meeting with you and your wife. I also have Havoc's occupational therapist with me. Her name is Megan.
Hi.
Havoc, I just want to know, how has your time in rehab been and how are you feeling?
Well, I think Havoc is doing fine, and we're just wondering how long is he staying at the facility, or how long is he going to keep receiving therapy, because I think he is ready to go home and get out of here.
Okay, definitely. I definitely understand. And I feel like I've spoke with his team, but I'm also going to need to collaborate a little more with his doctors and his nursing staff to make sure that he can be going home in 1 week and be discharged.
Oh, okay. Okay, so we'll just wait for you guys to decide, and then we can know when we can get ready to go home.
Yes. And Megan, have anything as his occupational therapist to add?
Well, we've been working on his ADLs and his transfers, specifically like being able to dress independently, just to reduce his, the burden for the caregiver. And right now he's like needs less assistance than he did when he first came. So we're getting there. He just still needs to do a little bit more stuff with PT, like walking up and down the stairs, so that that's not an issue when you go home. We want him to be safe.
Okay, so once we get home, how am I going to learn all these skills to help Havoc?
We can do some caregiver education.
Okay, that sounds good. Thank you, guys.
Yeah, and as your case manager, I can also speak with his physician and his other nursing staff and see if they have any other info to give you so that you feel comfortable taking him home and that Havoc is feeling good when he gets home.
Okay, cool. Thank you, Raquel. Thank you, Megan. Go home, Havoc.
Yes, we want you to be strong at home, Havoc.